Welcome back to Toledo Clinic TV. My guest is Dr. Moshir Jacob, and we've talked about the dangers of smoking for years. Everyone knows it's bad for your health, but people continue to do it. What would you say to those people?
Clearly, as you said, smoking is probably the #1 cause of preventable health hazards in this country, and not only here, it's across the world. It's responsible for 18% of death in the U.S. And you can enumerate all the effects that smoking can do, from strokes, heart attacks, cancers, lung cancer, mouth cancer, esophageal cancers. I mean, it is one of the reasons, one of the main reasons of preventable health hazards in this country.
Quitting might not be easy for people who are smoking. So you have what might be simple tips to help people quit.
Yeah, I have 5 tips. I mean, it's very simple, and I gathered that, you know, from questions of my patients. So #1, it's never too late to quit. A lot of my patients, they are in their 60s and 70s telling me, you know, it's too late. No, it's not too late. It's better to quit today than, and I have done this before, and a lot of my patients, even when they are 60 and 70 and 80s, when they quit at that time, they enjoy the rest of their lives in a much better way. Tip #2 is that don't give up. If you fail the first time, you try it again the second time. If you look at 85 to 90% of quitters that quit and successful now in not smoking, they didn't succeed from the first one. Quit turkey is one way, but most of those quitters, they tried multiple times before they are able to say, now I don't smoke. The third quit that I have is, the third tip that I have is that, you know, ask your doctor. That most, if not all, Toledo Clinic physicians, we have certain medications. There is at least 6 to 7 medicines that's approved to help you quit smoking. But it has to be under the guidance of your doctor, and your doctor will have a lot to offer. So if you can't do it on your own, then it's okay to get some help with medications. And I can tell you, these medications really help. And the fourth tip is that got to do with weight gain, because I got a lot of questions from my patients about, you know, doc, you know, I don't want to quit because I'm going to gain weight. I mean, it's acceptable, and we know that when you quit, you're going to gain a few pounds, and I say 5 to 6 pounds. Okay, so basically, what you try is to, when you quit, try to be a little bit more paying a little bit more attention to what you eat. And I always tell my patient that gaining a few pounds and quitting smoking is much better than, you know, continue to smoke with you know, without losing anything. And the fifth tip is that it also got to do with the fact that, you know, some patients tell me, doc, I just, you know, smoke about 1 or 2 cigarettes a week, only when I go out with my friends and so forth. And, you know, it's been clear, quitting is quitting. You quit totally would be better, so that you know that it's not gonna, you know, come back and hunt you later.
And you're not tempted then
to
have 1 a week or
exactly.
1 a day.
Most of the time, like what you said, most of the time, you know, I start with only 1 cigarette a week, 2, and then eventually, you know what, this happened or that happened, and then I went back to smoking. So when you quit, it's better to quit completely and 100%.
All right, good advice. Thank you, Dr. Jacob.
Oh, no problem, no problem. Thank you.
We're back in a moment.